36% of the time when students are engaging, they explicitly are choosing or stating that they just want to feel heard. And I think that's a unique thing about chatbots is it's really the only interaction where there's no judgment. You're talking to a neon colored llama. There's
Mhm.
no one on the other side there who's going to have any preconceptions, any biases, any judgments that they're going to share with you.
Hi, everybody. Here we are in a new episode of AI and mental health. Let's talk about it. Today, we're going to talk about AI and specifically youth mental health and the project that a very cool company is doing. It's called Alongside. And we have here with us Dr. Elsa Friis. Am I pronouncing it correctly?
That's correct.
Okay, good. And Dr. Elsa Friis is a licensed psychologist, a researcher, and a behavioral health advocate who specializes in utilizing technology to support youth mental health. And she's currently the head of mental health at Alongside, where she oversees the development of an AI-enabled mental health app that supports students in 5th to 12th grade. This is for people that are outside US. This is kids ages 11, 12 to 18 years old, correct?
Yes.
Good. And if I recall correctly, you got your PhD from Duke?
Duke University. You're correct.
Okay, good. So Elsa, first question that I have for you is why do you care about youth mental health? What caught your attention to this field?
Absolutely. I think we've all seen some of the sombering statistics on how many students and teens were struggling, especially after the pandemic, regarding anxiety, depression, suicidality. So we have the stats, but I think for me, it's also really personal. Prior to even getting my PhD, I worked in inner city schools in Baltimore. And that's where I really got to experience this intersection between how important youth mental health is to academic success and building those healthy, strong relationships that we know are so core and central for youth.
Thank you. And you are working in Alongside. What is Alongside?
Absolutely. So, Alongside was founded pretty recently, about 2 years ago in 2022. And our co founders were previously in a very successful ed tech company. And so they are working in ed tech. They had a product called Actively Learn. And what they were hearing from their school partners is students are really, really struggling. And we love the learning product that you've developed for us, but what can you do to help us outside of the classroom and outside of literacy? So, Alongside started by actually going to those stakeholders, students, administrators, counselors, and asking, what can we provide for you? And three main themes came out. They wanted something that was low lift. We know that over 90% of schools do not have the recommended counselor to student ratio. So this needs to be easy and low lift for our overburdened staff and counselors at schools. Students wanted it to be confidential. They wanted that safe place that they didn't always feel that they could get. They also wanted it to be reliable. A lot of students told us, we know what's out there in social media isn't real, it's not the facts. And so, where can I get reliable information? And then, third, they wanted it to be more engaging. And so that led us to actually explore building a AI supported chatbot where we're able to support students on their daily challenges and build those critical resilience skills that will help them learn how to navigate life's ups and downs.
An AI-enabled chatbot. It does it have a name?
This is it. This is Kiwi.
Mhm.
Students actually named Kiwi. This was hotly debated across all of our students. And so Kiwi is there 24/7 to support students and again, guiding them through things like bullying, creating new friendships. How do I actually resolve a conflict with a family member? Or on the other side, do things like studying tests.
Okay. And one thing that comes to my mind is as a teenager, would I talk to something that is provided by the school?
We had that same question. And so we worked really closely with our student advisors and interns to figure out how can we find that balance between confidentiality and making sure that this feels like we're also able to help students get the support they need if they are at risk or are experiencing more severe issues. So we are very upfront with students that this is a confidential space unless students are reporting things around abuse, harming themselves, harming others, or experiencing extreme levels of harassment or bullying.
And do you actually find that people endorse that teenagers endorse risk in this app?
Absolutely. So, students, I like to think of this as students who are kind of raising their hand and saying, hey, I need a lot more support. We see much lower levels of suicidal ideation than we would do if we do a screener. So, if we did a screener, we could find up to 25% of students who are really struggling with passive suicidal ideation or thoughts of self harm. In our case, we see about 2% of students are raising their hand and saying, I'm having a challenge. And when they do this, Kiwi is able to walk them through an evidence based screener called the Columbia Suicide Severity Rating Scale. And this is information that we can gather to assess their level of risk. And then we pass all of that information on to the school counseling team, who can then do a more rigorous in person assessment.
Okay, and what I've read is that these teenagers were not identified by the school staff.
Exactly. And so we're finding, especially when we're working with schools where they have a large percentage of English language learners, that they are having a lot of difficulty identifying those students who might be suffering. And so this gives a very easy and accessible way for students to kind of raise their hand and reach out. And alongside is currently available in 36 different languages.
Okay, I'm already a fan of Alongside. This alone, even if Alongside doesn't do anything else, this alone is worth it, right? Having been very close to teenagers that went through these experiences, I think that this has an immense value. I hope that school districts are jumping into it. So let me move forward, and I believe that you have a report based on 30,000 chat sessions. That's a huge number. I would love to learn about it.
Absolutely. And just as a caveat here, we do not share any student data. We do not share that outside. So this is all of our internal evaluation that was with de-identified data and information.
And what were the main findings that you got?
Yeah, so number one was students really just wanted to feel heard. And so I think we can relate to that on a human level that, you know, when I come home from work or I had a bad day, I don't really always want advice. I just really want to just have someone validate, provide empathy, feel seen, feel heard. And around 36% of the time when students are engaging, they explicitly are choosing or stating that they just want to feel heard. And what we know is that actually can open the door and is a foundation for kind of longer, more extensive problem focused conversations where we can focus more on skill building.
This is something that we've seen in probably all the studies that we've done, and with all the people that I have interviewed here, is that they tell the bot, thank you for being there, thank you for listening to me. So there's a huge need on the people to talk with someone or something. And some people doesn't like AI. It's good, don't use it. But there's many others that feel like here there's something for them.
Yeah, and I think it's helpful to think of this as in addition to those in-person conversations,
Mhm.
not as a replacement for conversations with friends, families, or mental health professionals. And if we think about it and having read some of these chats, a lot of times these are around topics that kids might not feel super comfortable talking about with friends or with a family member. And so this is a way to just really have that non-judgmental space. And I think that's a unique thing about chatbots is it's really the only interaction where there's no judgment. You're talking to a neon colored llama. There's
Mhm.
no one on the other side there who's going to have any preconceptions, any biases, any judgments that they're going to share with you.
Nice. And what are the things that are they are talking about, right? One is, okay, I want to feel heard, and the other ones?
So, around 40% of the time, they're discussing a variety of different interpersonal relationships. And so, I think we talk a lot about, okay, this is the COVID generation. They haven't had that social interaction. How can we actually support them on building those really meaningful and beneficial interpersonal relationships in real life? And this one actually, in some ways, surprised me because I think there's kind of this idea out there that like kids are only all about their phones and they don't want to have relationships. But kids are coming to us and saying, "No, I want relationships. I'm just like, how do I navigate this? This is really challenging."
Wow, super interesting. Thank you. And what about confidentiality?
Yeah. So, our initial hypothesis in those around 100 students we talked to at the very beginning of development who said this needs to be confidential. I think that's something we continue to see in our users. We even had teens kind of note to us that they didn't have other opportunities to engage in confidential conversations, and that their biggest challenge or concern about reaching out was that they were going to be judged.
And what other things did you find in this report?
Yeah, so this was a really interesting finding that exceeded my expectations. We found that when we built in our app the ability for students to reach out, that they actually started to use it. But we had to make it as easy and as simple as possible. We initially just had their ability to send a message to their counselor, but they had to actually physically type in what they wanted to say. We then made two modifications. We were able to match them exactly one on one to a specific counselor. So most students have a specific guidance counselor that they are assigned to. And so personalizing and making sure they knew who the message was going to, we saw a tiny increase in students reaching out. But what we ended up doing is we actually created a summary of the chat and we made that very friendly and we made it super easy and engaging and it really was complimentary to them. And with one button, they are able to send that. And so when we actually made it pre-written and it was something that they were proud of, 37% of the time, they actually shared and reached out with counselors. And it went from like 0.01% to 37%, which was really exciting to see.
Wow. Let me put a little bit of context, right? If we're talking about a child in a middle school, there may be 600 children in that school or 900 children, and maybe it's one, two counselors.
Hmm.
There's no human time that could address all the children in need there. And if
Yeah.
you are talking of a high school, there might be 2,000 teens that may need help. How can we address all this?
Yeah.
I honestly am thinking this should be mandatory in every school. I don't know what we're waiting, but I hope that you're getting a lot of traction from schools because I think this is a very useful resource. And you just show four findings. So
Yeah.
this is interesting.
Hi, one thing I was going to add in there was, we also really see us as helping and making the counselor's job as easy as possible too, and working alongside them. So one of the things that we actually have is this comes in as an email or on a dashboard. And then we also have pre-written an email back to the student. So counselors can give them that virtual high five or supportive validation with, again, just one click of a button, or they can write it themselves. But if you are feeling overwhelmed, like, great, fantastic.
Okay. At our company, Parent AI, we actually designed an AI platform to help the work between the parents and the therapist. And the idea is this same concept. We need to make the work of the therapist easier so that they can see more parents, right? And easier doesn't mean cheaper or doesn't mean less quality. It has to be even a better quality with
Mhm.
less effort from the humans because we know it, most of mental health providers are at the edge of burnout. So this is a great way of being able to expand our health. Amazing. Let me move forward with other things that you mentioned in this report. There's something about this is not just a girl problem. Can you share a little bit about that?
Absolutely. So we found on average that our male, female, and non binary students spend an equivalent amount of time engaging on the app. Now, there are some gender differences in what they're talking about, but they actually are using this. And as Musab, who was one of our amazing alongside teen advisors, explains, it's really important to break down a lot of the stereotypes um, around mental health. And I think one of the other ways that we do that is in our app, we're not talking about anxiety or depression, panic. We're talking about what are your day to day challenges that impact your mood or your behaviors. And so we are able to engage in conversations that actually resonate and make sense no matter your gender.
Wow, this is I didn't expect this one. This
Ah,
is
me
interesting.
either.
And I've been doing therapy with teenagers all my life. Amazing, good. There's also something about personalization.
I think one of the biggest challenges in providing more preventative psychoeducation or skill building or early intervention is how do we make it feel personalized and engaging? As I mentioned, we're available in 36 different languages, and we do see that the topics that students are seeking out are different based on age, gender, location, and lived experience. And so, one of the ways that we are striving to continually make sure that we're providing culturally responsive care is the personalization piece and including the teen users in the development process. And so making sure that we're relevant on the idioms of distress or slang, as I would call it, that students are engaging in. What are the hot topics based on different regions? What are the favorite TV shows, the GIFs and memes that are really resonating with teens? And we've built a really tailor-board platform that allows us to change the reading level based on your age and other preferences.
There's something that for me is mind blowing. What about social media? What do you think?
This was one of the most interesting findings for me as well is so across these 30,000 chats, literally a handful mentioned social media. So it was less than 0.24%, or how they were engaging with friends. So we know that they're engaging via different social media platforms, Discord, etc. But for teens, they're really focused on the quality of that interaction or engagement. So for them, we like to segment our world into tech and non tech. And the way that students talked about it, there's no difference for them. Engagement with a particular friend is engagement with a particular friend, and it can go positive or it can go negative. And, I think that while we know that building meaningful relationships is incredibly positive, there is a lot of research and data out there that does show that social media isn't inherently bad. It's about how you're engaging with it, what type of content you're seeing, and are you leaving that feeling supported? Or do you leave that interaction feeling like I'm not worthy or good enough?
One of the I think this is one of the hot topics because we're seeing lots of proposals to let's shut down all social media in the world, things like that. I don't think that that's going to be beneficial. People are relating in the analog world and in the digital world, and you see it here is 0.24% mention something about social media. So I think that the fear is more from the parents, right? And sometimes the policymakers, but it's like almost like a moral panic. Many years ago, the TV was the concern, then the video games. Now we saw that video games are not that problematic as we used to think. So it's good to start having a more data-based perspective about social media and youth development.
Oh, I was just going to add by villainizing social media, I think we're also, cutting off our ability to have a lot of really important conversations with youth. And if we center it more around the challenges they see, then we can find alignment and help them with a lot of the core issues that we might be attributing to social media.
Absolutely. And can you tell briefly about the technology? Is more like a rule-based chatbot? Is it a generative AI?
Absolutely. So, as I mentioned, we are just over 2 years old. And so we came on the market right as the cusp of a lot of these large language models, such as GPT-4, started to become more popular and actually really demonstrate a lot of proficiencies. So we have a mix of role-based and generative LLM approaches. And our main approach to doing this is to ensure that we have a really high level of safety and monitoring for students. But I also think about other ways that we use generative AI. So I mentioned not only the engagement with Kiwi, but creating that summary. That's an LLM. Monitoring for safety, that's an additional LLM. And now that we are having enough data, what's really exciting is our ability to actually further optimize generative AI based on how kids are actually interacting with it in our product.
Thank you. And what are the future steps for Alongside?
That is a great question. One of the things I'm really excited about is we are soon going to be sharing some results from our first quantitative study that was conducted by Dr. Jessica Schleider at Northwestern University. If you want to check that out, we are doing a webinar on September 18th. And I think what we're continuing to do is continuing to really focus in on how we can increase the personalization, the retention, and the engagement, but also think about how we're also supporting additional people outside of just the student alone. So strengthening our partnerships with schools. And as you know, with all of your work, thinking about how we can integrate parental support into this ecosystem as well.
Elsa, as a parent of a teenager, I want to thank you for working on this area. I hope that if people are watching us, is a teenager watching this video, please tell your teachers, hey, there's this product. If you're a teacher watching this, tell your principals. If you're a principal, tell the school business, the school district, please. I think this is something that we should all have in our children's school. This is an amazing tool. We can provide early screening, we can provide support, we can prevent them to develop a mental disorder. There's a lot of benefits of doing this, and there's not enough counselors. And even if there's enough counselors, we're not available all the time. So I think this is an amazing product.
Thank you so much. And if anyone wants to learn more, you can check us out at alongside.care.
Thank you so much.
Thanks.
Hope you enjoy this conversation. Remember, there's a bell over here or there that you can subscribe to the channel. Thank you, Elsa Friis, so much again, and I wish all the best for Alongside.
Thank you so much.